Hello everyone, welcome back to my YouTube channel Dr.Barki's Ophthalmology Tutorials. In this video, we will discuss about anti-glaucoma medications. Briefly, I will give the introduction to the anti-glaucoma medications and what are the points one should consider before starting the treatment for the glaucoma patients with respect to anti-glaucoma medications. How we can improve the efficacy of the drops which we are using. And finally, I will be giving the complete classification of anti-glaucoma medications. There are so many anti-glaucoma medications of the drops which are introduced now, which has really made the treatment of glaucoma much easier. And long ago it was just miotics and the epinephrine or the oral carbonic anhydrase inhibitors which we had for the treatment of glaucoma. And later in 1970s, the introduction of beta blockers really made a significant impact in the treatment of glaucoma patients. And now we have newer topical medications like topical carbonic anhydrase inhibitors, alpha-adrenergic agonist, and even the prostaglandin analogs. All these newer medications have significant positive impact on the treatment due to their increased IOP lowering effect as well as relatively low side effects. And before starting the anti-glaucoma medications for the glaucoma patients, doctor has to consider all these points and discuss with the patient and choose the appropriate drug for the patient. First of all, you should educate the patient regarding the disease. So explain what is the disease, how it progresses, and what will happen if the patient doesn't use the medications. So the need for using the medication, and the patient may need to use multiple medications instead of one drop. Patient may have to use 2 or 3 drops. The most important is correct technique of installation, which has to be demonstrated to the patient, and you should educate the patient to be compliant with the usage of the medications. It's like the medications for systemic hypertension or the diabetes, which they have to take daily. So similarly, here also patient has to be compliant with the topical anti-glaucoma medications for the treatment of glaucoma. So how we can increase the efficacy of these medications? So once we instill the drops into the lower conjunctival sac, then just gently occlude the nasolacrimal area, or even if the patient closes the eyelid for 3 minutes, it is sufficient to increase the efficacy of the medication which is used. And if the patient is using multiple medications, give sufficient time in between 2 medications, at least 5 minutes, so that the second medication will not dilute the first medication and decrease its efficacy. Now moving on to the important part of this video, that is the classification of anti-glaucoma medications. So we can classify these anti-glaucoma medications into those which will lower the aqueous production, those which will increase the aqueous absorption, and those which will create an osmotic gradient. Okay, so coming to the medications which will lower the aqueous production, here you can use the mnemonic ABC here. So A for alpha-adrenergic agonist, which include apraclonidine and brimonidine. Then we have beta blockers, in that again selective beta blockers and non-selective. In the selective we have betoxolol, in the non-selective we have timolol, levobunolol, metoprolol and the cortiolol. So all these lol will come in beta blockers. Then we have C for carbonic anhydrase inhibitors. In that we have topical and the systemic. In the topical we have dorzolamide and the brinzolamide, and systemic acetazolamide and the methazolamide. So for C you can also add calcium channel blocker, which is the newly introduced one for the glaucoma treatment. Where other medications can't be used, this will come in rescue. Here we have verapamil and the diltiazem. So the medications which will lower the aqueous production: alpha-adrenergic agonist, beta blockers, carbonic anhydrase inhibitors and the calcium channel blockers. Coming to those which will increase the aqueous outflow. So here again we have 2 types of aqueous outflow, as you all know. One is the uveoscleral outflow and the second is the trabecular outflow or the conventional outflow. Most of the drugs will act on the uveoscleral outflow. That is, we have the prostaglandin analogs. In that we have bimatoprost, latanoprost, travoprost, tafluprost and the latanoprost and B0. So all these will increase the uveoscleral outflow. So those which will increase the conventional outflow, we have miotics and the Rho kinase inhibitors. In the miotics, again it can be direct acting or indirect. In the direct it is cholinergic agonist, that is pilocarpine. In the indirect it is anticholinesterase agents. In that we have ecothiopate. Okay, so miotics you can write pilocarpine and the ecothiopate. In the Rho kinase inhibitors we have netazoidil. So coming to the third category, that is which will create osmotic gradient across, that is hyperosmotic agents. In that we have mannitol and the glycerol. This is the overview of your anti-glaucoma medications. In next videos we will discuss about each drug in detail. So hope this video on classification of anti-glaucoma medications is helpful to all of you. If you like my videos, please do subscribe to my channel. Press the bell icon for further notifications. Please do like and share my videos. Thank you so much.